There seems to be confusion regarding the last day for partial lockdown period in Khomas, Erongo, Okahanja and Rehoboth. Well, on the line is Mr. Ben Nangombe, Executive Director in the Ministry of Health and Social Services. Good day, sir, and thank you for joining us.
Yes, good afternoon. Thank you for having me.
Firstly, what is the exact date when the partial lockdown actually comes to an end?
As you recall, the President declared the state of emergency on the 17th of March. And on the 28th of March, one of the measures, namely the lockdown of Khomas, Erongo regions, inclusive of Okahanja and Rehoboth local authority areas, came into effect. According to the declaration by the President then is that the lockdown was to persist from the date of the 28th of March to the 17th of April. So that is what the President declared there.
The ministry has embarked on a project active case finding in Khomas, Erongo and Karas region. Now, can you elaborate more on how this process will actually be done?
Yes, we are saying that we need to get more data in order to determine if there are cases of local or community transmission of the COVID disease in Namibia. The only way we can get that data is when we engage in increased testing activities. It's for that reason that the ministry has now started to do what is called active case search. And for now, what is going to happen is that individuals who come to our hospitals or health facilities with acute respiratory symptoms, which would basically comply with the case definition of COVID-19 disease, although that person may not have a history of travel to an affected country, they will be tested. There will be random tests done. We want to do 20 tests or to test 20 individuals from the Khomas region. We want to test 10 people in the Erongo region, and we want to test also 10 in the Karas region. We hope that this will give us some kind of representative sample in order to determine particularly whether Namibia has a community transmission of the disease.
You mentioned active case search, Mr. Nangombe. Now, has the ministry made any progress in finding these cases?
As we are saying, we are looking at these cases. We are looking at testing people who are presenting with these symptoms at the facilities, and we test those. And so far, the tests that have been carried out have been negative, but that is doesn't mean that we are going to stop there. We are going to continue testing. Of course, we must also be careful in terms of preserving the available resources in terms of the tests themselves and the reagents that are used by our laboratories to do the testing for the disease. So that is why we must be careful in terms of how much we use, so that we don't run out of these reagents when we will need them should the case or the situation worsen. As you know, there is a high demand of these reagents on the international market, and we must be careful not to waste our bullets or to use up all our bullets so that we preserve them for the time when we really, really need them.
Yes, and finally, Mr. Nangombe, before I let you go, are we likely to see any door-to-door exercises as well?
You see, the Namibia Institute of Pathology is looking at increasing its capacity in order to do more and more tests. We are looking at rolling out a technology using testing equipment known as the Gene Expert machines. These machines are as good as the PCR machines that are being used in the laboratories of NIP in Windhoek. So as much as we are going to test for now, we do not foresee going into a door-to-door kind of testing situation. But as I say, the active case search is going to continue so that we get sufficient data to determine whether we have community transmission of COVID in our country.
Mr. Nangombe, thank you so much for that update.
You're most welcome.
And that was Mr. Ben Nangombe, Executive Director in the Ministry of Health and Social Services. Now,